Hello and welcome to the second webinar in our Quick QI webinar series. I'm Michael Dunn with the Excellence Through Quality Improvement Project, or E-QIP, and I'll be joined today by one of our brilliant coaches with E-QIP, Anna Mugimba. And today we're going to take a look at the problem. So if you recall in our previous webinar, the first in this series, we took a look at setting up our team and the composition of that team. And today we're going to dive a little bit deeper into, once we have our team, what is the problem that we're hoping to improve. So the agenda for today, we're going to briefly recap what E-QIP is. We're going to recap the model for improvement, which is really our roadmap for our quality improvement projects. We're going to talk about the project charter. We're going to take a look at the 5W2H tool and building our problem opportunity statement, followed by a little bit on the aim statement. So as you are likely now aware from our first webinar, E-QIP, or the Excellence Through Quality Improvement Project, is a partnership between Addictions and Mental Health Ontario, the Canadian Mental Health Association Ontario, and Health Quality Ontario to help support quality improvement within the community mental health and addiction sector, really building on our sector's already existing commitment to providing high quality person-centered care to individuals and families. And we do this through offering a menu of supports to our sector, including things like quality improvement and data coaching, education and training, a collaborative community of practice, and webinars such as this. And it's always helpful to come back to our definition of quality improvement, making sure to always keep this in mind as we go forward, and that quality improvement is not the same as things like implementation, evaluation, or quality assurance. But really what we're speaking about is quality improvement, a systematic approach to making changes that will lead to better client outcomes or better health, stronger system performance or better care for people when they enter our system, and enhanced professional development for our staff and workers. And it really draws upon the combined and continuous efforts of all stakeholders, healthcare professionals, clients, families, researchers, planners, and educators, everybody, to make our system better and sustain our improvements. In our previous webinar, we discussed really three conjoined models that make up quality improvement. The first on the far right is what I just spoke to. It's that quadruple aim, our desire as a system and as folks working within the system to provide the best care for clients as possible, so that people will be happier and healthier. And we want to do that while both supporting our providers and trying to be as cost efficient as possible, because we know that funds are not endless in healthcare. And to achieve that quadruple aim, we try and make improvements on those domains of quality. So trying to make our system continuously more timely, equitable, safe, effective, integrated, and client-centered. Those things that people tell us mean quality care to them. And to do that, we have our QI tool belt, which is the focus of these webinars, and that is that model for improvement, where we ask three questions. What are we trying to accomplish? How will we know that a change is an improvement? And what changes can we make that will lead us to improvement? And then we test those change ideas using our Plan, Do, Study, Act, or PDSA cycles. And in our first webinar, we introduced the example of Live Well Recovery Services. And we're going to use that same example throughout this series. And it's a completely fictitious example, but it's looking at Live Well Recovery Services, a community-based mental health and addictions provider, which is located in a mid-sized town of about 100,000 people and they have 3 sites within that town. And they serve clients both in the city center, the suburbs, and in rural surrounding communities, and are responding to a wide range of complexities of client challenges. And one issue that they've experienced for quite a while is around access to their intensive case management program. Long wait times for that intensive case management program. And they've made that a priority. It's on their strategic plan, and the team would like to address wait times because it's a source of frustration and dissatisfaction for their clients. And this has been demonstrated through feedback that they've received in surveys and focus groups. The intensive case management manager has looked at the wait time data for the last 2 years and have noticed a steady increase in wait times for service over that period. And currently they have 108 days wait from the point of referral to service initiation, which is far less than ideal. And it's important to define what we measure. And in this case, the date of referral into the program is documented through their client management software and is defined as the date that the referral source or the client themselves first makes contact with the agency requesting an assessment for that individual. I'm going to turn it over to Anna now, who's going to walk us through starting to think about and define our problem. Anna?
Thank you, Mike. So here you have, again, it is a roadmap for the stages in the Foundations for Quality Improvement, as well as tools that are involved in the process. In the last webinar, we went through the project charter and the team composition. And in this webinar, we're going to discuss the problem statement, problem/opportunity statement, as well as the tool, the 5 W's and the 2 H's. Also, in the last webinar, we pointed out the project charter. And in this section, we're going to talk about the problem statement, which is in the pink area, which I'm going to go through next in the next 2 slides. So problem statements are great. Oh, in the project charter, you saw a space for the problem statement. So what exactly is a problem statement and why is it important? A problem statement contains 1 or 2 sentences that identifies and summarizes a condition, problem, or issue. It also provides a clear expression of what the QI team is set out to achieve and does not talk about solutions. So problem statements are great, but more often than not, in QI, QI will be rooted in a problem that you're trying to fix. However, sometimes your QI project is not about a problem that you want to fix or a problem that has even been presented, but rather an opportunity that has emerged and may enhance client care. So in the case of an opportunity statement, the structure is the same, so it contains 1 or 2 sentences that identify and summarize the opportunity that may increase the care received by the client. And it contains a description of what it is you're trying to improve, why, and what is the intended outcome. So here we have the components of creating a problem statement. So you want to answer the 5W2H's question to get to the crux of your problem/opportunity statement. So what are these questions? The first question is, what is the problem or opportunity simply stated? Why is it a problem or an opportunity? Where do we observe the problem and the opportunity? Who is impacted by this problem or opportunity? And when do we first observe this problem and opportunity? How does it affect clients, family members, caregivers, and staff? And how often does this occur? So there is a worksheet available on the E-QIP Collaborative Community of Practice that can help you with the steps of answering this question. To get the information that you need for the problem and opportunity statement, you can use this worksheet. This is the first step that we need to clearly articulate our problem and opportunity that we're trying to fix or create, and it is the basis for the QI journey on a particular issue. It's really important that there is a fidelity to this process, and that we make sure that we write out pretty much everything by answering these questions very simply and very plainly in order to give us like a foundation and a basis to go to the next step. So some things to consider. Within your problem and opportunity statement, do you have data available to support this problem? It would be really good if you had a sense of data that you could pull that kind of supports your problem, and that would be a good place to start as opposed to only relying on anecdotal information. Are there other parties that are impacted by the problem who should be at the table? This speaks to the team composition. Initially, at the first webinar, you would have the composition, you would have your discussion about your problem, but sometimes you may find yourself at a point where, okay, well, since we have identified this problem, someone who is the team lead now should be switched, or the process owner. So that's something that should be considered once you define the problem or opportunity statement, is rejigging the people who are supposed to be at the table. Are we looking at this problem from the client perspective? It's very important to make sure that you're looking at the problem or opportunity for the client perspective, because it's important to inform that perspective within your project so that it could have the richness that I was talking about in the first webinar to actually help you on your QI journey. Are we looking to blame? This is a very important part in QI, where you don't want to develop a statement that says we have this problem because of these people or this person. You want to actually focus on the problem as its own isolated thing and not place blame on anyone or other people. And are we jumping to solve the question? And if you ever find yourself doing that, you want to stop yourself, because you want to make sure that you remain true to the model of improvement. And as you go through this process, you may have some hunches that you have solutions, right? But at the beginning, it's not good to put those down, because then it kind of blocks the creativity within the diagnostics, which you will learn about in other webinars, to actually kind of explore and see if you could come up with different solutions at the right point in the process. So it's important to stay true to the model.
Great, thank you very much, Anna. So now we have a bit of a flavor for that 5W2H tool, those questions that we want to ask to help us understand and articulate our problem, and the importance of, once we answer those questions, putting them into one succinct few sentences, short paragraph that clearly states our problem without jumping to solutions, without jumping to blame, but something that all of the members of our team, as well as external stakeholders, could pick up and read and understand what the problem is and why it's important that we're hoping to improve. And so Anna led us through that 5W2H tool, and we're going to take those questions now and apply them back to our good old example of Live Well Recovery Services. So again, those questions that we're going to ask are, what is the problem or opportunity? Why is it a problem or opportunity? Again, not jumping to why is it happening, but why is it a problem? Why does it matter? Where do we observe this problem or opportunity? Who is impacted? When do we first observe this issue? How often does it occur? And how does it affect clients, families, caregivers, and staff? So taking this tool and applying it to our Live Well Recovery Services example, when we ask, what is the problem or opportunity? Well, clients of Live Well Recovery Services Intensive Case Management Program are waiting, on average, 108 days from referral to service initiation. So why is this a problem? Clients that are appropriate for the services should not be waiting this long for care, as mental and physical health can decline significantly over such a long wait period. Where do we observe this problem or opportunity? Well, we observe it within the Live-Well Recovery Services Intensive Case Management Program and specifically on our wait list. Who is impacted? Clients, family members, intake staff, case managers, reception, senior leaders within the organization, as well as community partners, because we recognize we're part of a larger system. So when did we first observe this problem? Well, this has been a long-standing problem, but the wait list tends to indicate that the problem has been steadily growing over the past 2 years. How often does it occur? Clients are experiencing this issue daily. And how does it affect clients, families, caregivers, and staff? Well, clients' mental and physical health is likely to decline if they're waiting 108 days for care. Well-being of family members is negatively impacted as well. Staff are impacted emotionally through the inability to serve clients quickly and address increased complexities. After waiting significant time for service, place time constraints on staff. Health system may be experiencing increase in walk-ins or emergency department visits because folks are not able to access the intensive case management service that they require. So as you can see, we have now a lot of information about our problem, a lot more than simply saying that we have long wait times. We now have all of the details that really clearly demonstrate the size of this problem that we're looking to tackle. Our next step, as Anna went through with us, is to take all of those details and refine them into one clear problem statement that will communicate both within our team and external to our team the details of our problem. So for our example, we took those key ingredients from that 5W2H tool and combined it so that we now have a statement that reads, the wait time from referral, initial contact with Live-Well Recovery Services, to service initiation experienced by clients wanting to access Live-Well Recovery Services Intensive Case Management Program has been steadily increasing for 2 years. Currently, clients that are referred into the program are on average waiting 108 days for service. Long wait times are prolonging periods of unwellness for clients, increasing stress and frustrations felt by family members, and leading to overall higher complexity levels for staff when service does eventually start. So hopefully that makes sense so far in where we're trying to get to and why. And once we have our problem statement, we can start to think of our high-level aim statement. And there'll be more details on aim statement throughout this webinar series. But at this point, we want to introduce it as really the flip side of our problem statement and trying to answer that first question in our model for improvement, which is, what are we trying to accomplish? And so a good aim statement addresses an issue that's important to those involved. It is specific, it's measurable, and it addresses 3 very important questions. For whom, by when, and by how much. And so anytime we write an aim statement, which is setting us up to where do we want to go in our improvement, again, that flip side of that problem statement, we want to make sure that we're as clear as possible and articulating by how much do we want to improve, by when do we want to improve or to see this improvement happen, and for whom. And so jumping back to our Live-Well Recovery Services example, I think an example of an aim statement for our current challenge around wait times for intensive case management could look like this. We will decrease the average wait time from referral to service initiation into Live-Well Recovery Services Intensive Case Management Program to 10 days by April 1st, 2019. And so if we look at this aim statement through our aim lens, we can see that we have those ingredients. We're very specific about where this improvement is going to take place. we're very specific about how much we want to improve. We said 10 days, and by when, April 1st. And so we can then apply a SMART acronym. Whenever we set goals, we can think of SMART and look at, is this specific? Is it measurable? Is it achievable? Is it realistic? And is it time bound? So you can apply that lens to your aim statement as well. And so at this point, we've now gone through looking at our problem statement. As you recall, in the first webinar, we looked at our team composition. We now have our problem statement, and we've touched briefly on setting that aim statement, that mirror image, that flip side of that problem statement. And for our Live Well Recovery Services example, we start to see our project charter getting populated. You'll see the yellow makes up our team, the purple makes up our problem statement, and to the right of that is our aim statement. And so we'll continue on in the third webinar in this series, beginning to look at the diagnostic tools. So once we have a problem, taking a look at the root causes of that problem and where will we really get our biggest bang for our buck as we try to improve. So stay tuned for that on our third webinar. If you have any questions or would like some more information from us about the content of this webinar or more about E-QIP, please reach out to myself, Michael Dunn, my colleague Debbie Bang, or Jenna Hitchcox, our program manager. You can also join our E-QIP mailing list for all the exciting E-QIP news and offerings by visiting the URL on the right of your screen. Thank you very much, and we'll see you on webinar number 3.